Hey, Rick.
Good morning, everyone. We'll get started in just a moment or two. Good afternoon, everyone. Thank you for joining us. I know people are still joining on, but I think we will get right to it because, as usual, we have a very full agenda. So welcome. This is our more or less quarterly update meeting where we share all sorts of information and developments related to health and human services workforce issues. And as always, there are many. Also, as always, we have a really wonderful cross-section of partners represented in this meeting today, attending this meeting: public and private sector, health and human service provider organizations, higher education, community and labor organizations, professional and trade associations, advocates, and more than that. So thank you all for your participation. We really appreciate your continued engagement. Today, as you can see from the agenda, will be a mix of big picture policy and planning initiatives, along with some very specific program updates. Before we get into those updates and some of the current events, we wanted to share with you a little bit today some reflections and a look back at this very unique public and private health workforce planning initiative that we've maintained in Rhode Island now for the past 3.5 years. We've accomplished an awful lot since that effort was launched back in the spring of 2022. Of course, much work remains to be done. So to share a little bit of perspective on the work we've done and where we go from here, I'm going to turn it over to Elena Nicolella, who is the CEO of the Rhode Island Health Center Association. Elena.
Thanks very much. Thank you, Rick, and welcome to everybody. It's great that we continue to have these quarterly updates and we get close to 100, if not more than 100 people on them. I'm hearing
I'm hearing
an echo.
an
Are you
echo.
guys hearing the echo?
Are you guys hearing
Yep.
the echo?
Please mute yourself. Okay.
All right, that's better. Thank you very much. So, as Rick said, my role here is just to provide some context for this update and place it in the space of this overall effort in case there's people who are brand new to this work joining us for the first time, or if you're a little bit like me on a Monday and need a reminder of what meeting this is, who you are, and why you're here. So I'm hopeful I can meet everybody's goals with this. As Rick said, this effort started in 2022, and those agencies that he mentioned, it's not that they were not pursuing initiatives in the health workforce arena, but what changed in 2022 was this explicit acknowledgement that we needed a strategy across government agencies, and also we needed engagement from the private sector. So that is what makes this overall effort pretty unique. The first summit was in 2022, and then we had follow-up summits in 23 and 24. And in that time, I have a picture here of Rick. He did a TV and radio road show for a little while, just highlighting the effort, which was great. It was great to turn the television on and see Rick on it. But at the first summit, a participant, and maybe one of you is the participant that said this, essentially said, look, this is great. We've had a lot of great conversation, done a lot of good work, but I don't want to just go back and lose the momentum. So that is why we created a planning council, and we have all of these touch points to keep us engaged. If you could go to the next slide, please. So these are three of the ways in which we keep that private sector engaged, and we also try to stay on top of all of the different activities that are happening, because what you'll find is this health workforce initiative, I think, is highlighted by two, I'll use the word again, unique components. One is that private sector engagement, but the second is just the pure breadth of the activities that you'll hear a little bit more about some of them after I'm done speaking. But in terms of the private sector engagement, we do have an ad hoc team that gets together once every 2 weeks now, I think it is, to ensure we're all informed about where the state is, what's happening on the private sector. EOHHS also issues a quarterly newsletter, and then we have these quarterly online update meetings. So that's what you're attending today, one of these quarterly online meetings. You can go to the two sites that were on here for just overall information about the effort. And then, yes, if you could go to the next slide. This is just a slide to orient you to the three categories in which the state and the private sector engagement have pursued. So career awareness and outreach, this would be working with the career and technical groups in high schools, and that's just an example of one of those. Higher education supports. This is a picture of the loan repayment ceremony that we had earlier this year, and then pathways and pipelines, helping people to enter into the health workforce, or if you're already in it, to succeed there. So looking forward to hearing about the updates from the programs, and also if any of you on the call want to learn more about the private sector engagement, please contact anybody on that list, including me or Rick. Thanks very much.
Thank you, Elena. Really appreciate that. Before we get into some of the updates and more of today's agenda, just a few thoughts about where we go from here. As Elena said, we've accomplished a lot in the last 3.5 years, and those accomplishments are really all attributable to the partnerships that we've developed. And now we're heading into some really uncharted waters, not unlike when we started in the midst of the pandemic. Um, the first order of business for us really is to sustain the achievements that we've made, and some of those are shown on the slide. Quite a few different initiatives that are in place now, most of which didn't exist 3.5 years ago. We know that there's dramatic federal policy changes in the works that will significantly impact many of our organizations and the people that we serve. They will also impact our state budgetary resources, and that's going to further constrain our programs and services. But despite these challenges, our work will and really has to continue. Um, some of the accomplishments that we've made in the past required funding, but many of them didn't. They just required organizational or political will to form partnerships, to advocate for and pass legislation, to make policy changes. And it's that kind of leverage, that kind of collective power of partnerships that we're going to tap into to sustain our accomplishments and also to continue to make progress. In order to do so, we're going to have to be more strategic than ever, I think. We're going to have to identify new funding sources and strategies, sharpen our priorities, and strengthen those partnerships. And even as we speak, we're working in an unprecedented fashion across the state to develop some new initiatives, in particular the Rural Health Transformation Program, which you're going to hear more about. But we're also launching things like our behavioral health workforce planning process in just a couple of weeks. We're continuing to expand our healthcare workforce data collection. Real Jobs Rhode Island at the Department of Labor and Training will soon be funding new healthcare workforce partnerships. And partners are working to develop legislation for the coming session, including a proposal to expedite pathways to licensure for foreign trained dentists. There's still a tremendous amount of energy, a lot of work to be done still, and we really need and value your continued engagement. If there are specific thoughts or priorities that you'd like to make sure are on our radar, or you want to yourself be more involved, please indicate that in the chat. Okay, thank you. So now we're going to dive right into it, the part of the program updates, and we're going to start with an update related to Ladders to Licensure program, which is a new grant program that funds partnerships of employers and higher education institutions to work together to support unlicensed paraprofessional employees to return to college and pursue a health professional degree and license. And I believe on this call with us is Karen Holy, the Director of Education and Professional Development from Kent Hospital, to talk about their participation in the Ladders to Licensure program. Karen, are you with us? Oh, maybe not. I know she was planning to as of a half an hour ago. So let's skip over that for now. And we will move on to another item that I just mentioned, which is the Behavioral Health Workforce Planning Initiative. And for that, we're going to turn to Tanya Glantz from Rhode Island College.
Thanks, Rick. Can you hear me okay?
Yes.
Excellent. I have you on two devices, so let me lower the other one. Okay,
Sorry?
perfect.
You're good.
So I'm just going to give a brief overview of the work that is going on. Similar to other healthcare settings, behavioral health providers and clients are experiencing workforce shortages. Some of it's actually being addressed also with the Ladders to Licensure. However, until recently, there hasn't been a table where the challenges experienced by the behavioral health workforce were the sole focus of the conversation and strategy planning. And so fortunately, in recent months, the Governor's Council on Behavioral Health established an ad hoc behavioral health workforce committee that was concurrent with another process, which involved EOHHS enlisting Rhode Island College to lead a recovery workforce career ladder planning process. And the two are very complementary. And together, both of those efforts are going to be focusing on improving career pathways that will undoubtedly focus on supporting and growing the behavioral health workforce. And I know that Rhode Island College and the folks that I spoke to at EOHHS last week are excited to expand avenues for input from a wide variety of providers, and many of who are here today. And we look forward to hearing from everybody. Thanks so much.
Thank you, Tanya. And now we're going forward. Now we're going to hear from Kevin Andrade, who is with the Division of Information Technology at the Department of Administration. And Kevin is a tech whiz who has assisted EOHHS in developing a new tool on our Caring Careers website called My Career Pathway. So I'm going to turn it over to Kevin, and I think, Kevin, I'm going to, I think you can share your screen. Is that right?
Not yet. You'll have to give me that permission. So if you go to people at the top of Teams,
Yes.
then you should be able to do it there.
Okay.
Oh, I see. I was referring to the part
Do I need to make you presenter?
and information.
Yes.
You should be all set.
All right, thank you.
That's my question. Okay. All right.
Okay.
Okay.
So
Why don't we jump to you?
So this is the Caring Careers website, which is one of the other EOHHS websites that we work on. And so over the summer, me and Rick and the EOHHS team had made a new tool called the My Career Pathway. And now Rick will be able to give you a better description of what it does for like people, as I'm more on the tech side. But basically, people can fill out a short quiz and they select like categories, where they want to work, the type of education. It'll give them a list of jobs related to what they've selected during the quiz. And then it'll show them available jobs like related to that, and training programs for that job type as well. So I'll run through it and show you an example. So first was the category, then we'll select the education. Then we select like the work environment. Then it'll give you some jobs that comply with what you picked during that. So we'll select registered nurse, give you some more information. And then it'll link out to EmployRI. Then you can see what's available in Rhode Island. And then also on the details page, you can see what trainings and degree programs are available. As you can see, we have this Johnson & Wales one. You can see all the information for it, and then it will link to that on the Johnson & Wales website to see their nursing program. So yeah, that's pretty much it.
Great. Maybe we'll take a minute. That's terrific, Kevin. I wonder if we can just take a minute and see if folks have any questions about this. It's a pretty dynamic new tool. I see a hand is up here. Bethany, Korea. Bethany, if you have a question, go right ahead. Unless we're not able to hear you for some reason. All right, there's a question in the chat from Ara, I believe. Where these opportunities are coming from, Ara, is on primarily EmployRI, which is as you may know, the job bank that's maintained by the Department of Labor and Training. Any and all employers can register to post their jobs on that website, and we highly recommend that employers do that.
Yes, and that's so for the EmployRI site, right? They have their own feed for the actual available jobs, and then these are maintained like So these job descriptions are maintained by EOHHS.
Thank you. And Bethany has put her question in the chat. The question is, how is this site shared with the public? Who sends prospective employees to search via this tool? So we have in the past had resources to do some significant promotion of the Caring Careers website. We did that through a variety of social media and postings so that it would come up in Google searches and that sort of thing. We also encourage those who work with job seekers to use the Caring Careers website, and it's really, I suppose, incumbent on all of us to continue to let our colleagues know, and job seekers and so forth, students know of the resources available on this website. And Kevin didn't jump through all of it, but there are descriptions of loan repayment resources, detailed descriptions of each of the major job categories in healthcare, so folks can learn more about what a social worker does, or a peer recovery specialist and so forth. And they can get links to the education and training programs that can prepare people for these jobs as well as for the jobs themselves. I see Kumbi's question about how we can post jobs again. That would be by registering on the EmployRI website. If you go to EmployRI, there should be guidance on how to register as an employer and post your jobs. Okay, any other comments or questions? If not, Kevin, I guess I need you to unshare, is that right? Or,
Yes. It looks like
Any-
Bethany has another question.
yeah. Bethany, if you have a promotional poster information, it would be good to share with us. Yeah, we will share this in a future email for sure, in one of our future electronic newsletters. And Elena asks, is EOHHS considering leveraging this tool for upcoming Medicaid work requirements? It's an excellent thought. And I will take that back. It would be a great opportunity because, as many know, the work requirements for Medicaid beneficiaries, SNAP beneficiaries, will be increasing. And actually, we're going to hear about that in a little while during this meeting. So with that, see if I can figure out how to go back to the how about that? Are you seeing this?
Yes.
Excellent.
Yeah.
Okay, with that, speaking of those federal policy changes, we're going to turn to James Rajat, who's our Director of Strategy here at the Office of Health and Human Services, to talk a bit about those policy changes. James, take it away.
Great. Good morning, everyone, or good afternoon at this point. Thank you for being here. You've heard from me before. Some of these slides will be similar but updated to give you key information, and I'm happy to answer questions as we continue to move forward. So we can go to the next slide. So as a reminder, House Resolution 1 passed and created a variety of changes specifically to our Medicaid, our SNAP, and our health insurance marketplace. And right now, members do not have any actions that need to be taken. The earliest actions will happen later in the fall, and you'll hear information from our Department of Human Services related to SNAP. Then we'll have some changes that affect in the new year related to HealthSource Rhode Island. And then beyond that, really particularly starting next year, will be the Medicaid side. Next slide. As a requirement of our state budget, we were asked to pull together a public advisory working group called the Federal Compliance Advisory Group to evaluate the potential impacts of these changes of HR1 on the state and these three, and specifically the Medicaid program. The Secretary has expanded that to include SNAP and the health insurance marketplace, with a report due no later than October 31st. That details both these potential impacts and considerations that the executive and legislative branch should consider as we're evaluating these changes. You will see here a bunch of sectors that are appointed onto the work group in order to ensure that we have a whole of community approach to this report design and comprehensive community feedback. Next slide. To summarize some of what's happening on the SNAP side, there are 7 changes that affect the state. About 14 to 17,000 individuals will be affected by these changes. If at a high end estimate, if we continue with our current error rate and other items related to the SNAP program, it's about $73 million of new funds that are needed to comply with the changes that are being implemented. And it's approximately $15 million in SNAP benefits that will not be provided because of eligibility changes to SNAP. And so there will be a lot of additional benefits that are not provided to end users. Next slide. This shows the timeline of implementation. So for fall 2025, which is everybody's main focus, the standard utility allowance changes happen. The expansion of the work requirements happen, which is called ABOD. You'll see that noted there. Changes to who's eligible from immigration, as well as the ending of the SNAP Ed program. Those changes we are anticipating November and beyond. But we, again, our Department of Human Services will go public as we are still awaiting some guidance. And as you know, the federal government is shut down. Next slide. On the Medicaid side, there are some significant changes happening. Highlights here include that the retroactive coverage for populations will be changing. So traditionally in Rhode Island, it's been 3 months. We'll be moving to 1 month for the expansion population, as required, 2 months for the non-expansion population, and up to 2 months for CHIP in terms of retroactive coverage. We know this will provide great challenges for some of our providers, particularly on the nursing home and other side of the house. Medicaid renewals for the expansion population will happen every 6 months instead of once a year. We will have co-pays or cost sharing for the expansion population, more detail and guidance forthcoming. And we will have work and community requirements for the expansion population in Medicaid, and those will be new. Next slide. Here's a list of all of the different changes affecting the Medicaid program, and as you can see, it is a long runway for these changes. And the items in bold are those that are pretty significant. Most of the eligibility and other changes, as I mentioned, will happen in SFY 2027, and so are not as a current issue being implemented as of today. Next slide. We continue to hold our public meetings. Some of you have been here. I've seen the names and appreciate those of you who have joined either virtually or in person to provide us feedback. We had our kickoff, then we went through the SNAP analysis, then we went through the Medicaid analysis. Coming up as of tomorrow will be our meeting at the EOHHS Works meeting, building on our health insurance marketplace, and this will focus on Health Source Rhode Island's analysis related to the marketplace changes and the ending of enhanced tax credits and other things of that nature. And then we'll have our final meeting in November to debrief the process and provide an overview of the report that was submitted. Next slide. Here's a general overview of what's being included in our reporting and has been part of our discussions, particularly around specific requirements, the timelines, the repercussions if we don't comply, what are the additional penalties, what does the impact look like across both providers, populations, technologies, state authorities, the safety net, and which ones create more challenges for others within that framework. So for example, as you make some changes to eligibility in SNAP, it increases the error rate potential, for example. So calling some of those specifics out. And then what are other states doing? What are we hearing and seeing nationally in terms of compliance? What about states who've already been doing things like work requirements in Medicaid? What can we learn from them in terms of considerations? And then again, a summary of all of our community themes that we've had from our gallery walks and in-person feedback. Next slide. So how can you get engaged? This website, I'll put it in the chat as soon as I'm done speaking, is where you can find these public materials and all of the analyses from the different agencies per meeting. All of our public messaging is going out through Stakeholder Rhode Island, and we are working with specific agencies to do specific lettering and other things to community members that are affected prior to any official system-generated notices going out about a change. There will be some additional partner briefings and other things happening. Our DHS partner briefing will be next Tuesday to give some additional information. The item that is of most importance is, as you can see in the orange box, we have 3 online surveys available at that website that I just mentioned, the federal compliance website, where we have them on Medicaid, HealthSource, and SNAP. We have that open until I believe it's October 12th or 13th. Please submit if you have any impacts that you'd like to share with us that certain provisions will have, and then any potential ideas or proposals that you might have to help us solve for it, consider, create a more robust safety net, think about additional revenue options, whatever those are, we want to hear from you so we can pull that into our final reporting. Next slide. So as just in summary, we are working actively to mitigate as much as we can, but there's no way around the fact that there will be impacts on our programs and there will be impacts on our beneficiaries. We already know our safety nets are stressed and that this is going to add to that. And what we are trying to continue to do is work again from a whole of community perspective to create the strong social safety net that we need, and then advocate to protect our most vital populations, but also make sure that they are informed and get that targeted outreach that they need in order to comply as best they can or be connected with the resources that are out there as these changes come fast and furious within the state's ecosystem. Next slide. With that, I will answer questions in the chat and I'll put the links to the surveys as well as the public materials. Thank you, Rick.
Great. Thank you so much, James. Really appreciate it. And sticking with the federal focus, I'll let Marty do this transition, but I want to thank James for that presentation and thank Marty for her role in herding a whole lot of folks together around a exceptional grant opportunity called the Rural Health Transformation Program. So Marty, take it away.
Thank you, Rick. But Bethany has her hand raised. Perhaps if it's a quick question for James.
I think, is that true, Bethany? Or it's been up for a while, so I'm going to help you lower your hand. There you go.
Thank you so much. It's great to be able to share this with you. It is kind of incongruous next to the presentation that James just gave, but this is a tremendous opportunity for Rhode Island to support our rural health towns and the folks who live within them and work to support people in rural towns. So next slide, please. The opportunity, you probably have heard about it. It's a 5-year CMS initiative. It is $50 billion overall for the entire country. There are 2 areas of funding. Base funding, which every state is eligible to apply for, equals $100 million a year if all states apply and are approved for 5 years. So we would be very much eligible for $500 million total amount over the next 5 years, starting next January. And then the component of the grant that is called workload funding. This is based on the proportion of the state's rural areas. We are in competition with other states for an additional $100 million for 5 years. We are going to do our best to get all of the funding that we can be eligible for. For this second tranche of funding, the second $100 million a year, it's a little bit more challenging for us in this competitive nature, but we are going to push for as much as we can get. Application is due on November 5th. We are uploading it on November 3rd. CMS will decide by December 31st. And I want to underline that this is one-time funding. We are not allowed to use these dollars to fill current or potential budget holes. So when you take James's presentation and mine together, you see that these are two areas of work, and we're not going to be able to, address some of the challenges that James just raised with this funding. Next slide. The work that we fund with the grant dollars must fall into one of these 5 goals. The first is prevention and chronic disease. This can include payments to healthcare professionals, technology for consumers, et cetera. This is really looking at that long-term prevention and chronic disease. This includes behavioral health and addressing SUD, substance use disorders. Number 2 is sustainable access to improve efficiency. This is coordination among rural facilities. This can include, for instance, mobile health, mobile EMS, mobile integrated health as it's called, and other ways of getting community entities to work together to coordinate their service for our rural residents. Number 3, very much of interest here, workforce development and transformation, training, payments to encourage providers to practice in rural communities. This can include loan repayment and other, recruitment and retention. I want to note that there is a very particular requirement for recruitment and retention and those kind of loan repayment for professionals that folks have to commit to practicing in rural communities for 5 years. It's not everybody who takes a training, but it's more of those actual payments to healthcare providers. Number 4 is health information technology. We can add to the health information exchange. We can help people with electronic health records. There is a limit on the amount of money. It's 5% that we can spend on some pieces of this, but it's still a fair amount of money. And then the 5th one is innovative care models, value-based payment, models that are like the accountable entities or accountable care organizations. Next slide. So I'm not going to read all of this, but there are elements that are here that you can look at when you review the slide on your own that underscore how we must create a rural health plan. We need to look at outcomes. We need to recruit and retain clinicians, long-term financial solvency. So as we create the plan, we are keeping all of these forefront in our mind. And then on the next slide, you can see a list of possible activities that we must choose at least 3 to carry out. And I can tell you that in the work that we've done in the community engagement that folks have shared with us already, I think that we're going to get to at least 8 or 9 of these. We're not going to have any problem at all choosing at least 3. And you can take a look at all of these, when you review the slides. Next. What is rural? There are a number of different definitions, but this is the one that we are using for our base funding. There are 18 rural towns. HRSA has allowed us to use this definition in the past. So plus federally qualified health centers and certified community behavioral health clinics, CCBHCs, who serve in rural towns may qualify as well. This is the definition that we are using for the first amount of money. For the second amount of money, CMS is giving us the specific HRSA definition, which includes Block Island and Westerly. They may allow us to think about these towns also, but the way that we're thinking about it is for the first amount of money, the $100 million a year for 5 years, we are absolutely looking at ideas, proposals that address these towns. Next. Here is our timeline. September was community engagement, and obviously we're doing some in October as well. In October, we are writing furiously. We will upload to the deadline of November 3rd so that we have no problem making sure that it is in on time. As I noted, we will expect award notices by December 31st, and then January it begins. So I can't underscore how quick this is and how much information we have already received. I am here talking with you. We want everybody to know about this. If you go to the next slide, you will see an email address where you can give us more ideas, but you may have heard or seen or already participated. We had put out a survey as soon as the application was made public from CMS. We got almost 300 responses to the survey with either general ideas and suggestions for how we approach this sort of overall, and then specific, much more specific project ideas. We said to everybody that this is, that survey was not a procurement. Just because folks have replied does not mean that we will be able to fund everything. There will be procurement, formal procurements for, much or most of the dollars that will be shared. But we still want to have your feedback. If you've got an idea, send it to us. Again, no promises with this, but we're going to have community engagement all the way through. If you have ideas for who we should send a procurement to because somebody who would be interested in running something later, we'll want all of those ideas. We're going to keep community engagement probably through the EOHHS Independent Advisory Council, which supports the Healthcare Planning Initiative. And we will make sure that this will be a vibrant discussion throughout the 5 years. How do we best serve our rural neighborhoods, which have, when you think about where dollars often go, there have been gaps, and this is a really tremendous opportunity for us to help identify those priority needs and fill those gaps. So please bookmark this email address and use it whenever you want to get in touch with us. And we're really looking forward to putting together a quality application that brings us at least $100 million a year for 5 years, which, as CMS has noted, we hope to be a generational change for rural Rhode Island. I'm happy to take any questions.
Thank you, Marty. And we do have a question from Nicholas Oliver.
Hi, Nicholas.
Hi, good afternoon, Marty. Thanks for providing us with that information. With the responses that the Department of Health is collecting through the portal or through the email address, will Department of Health and/or EOHHS be putting out a response document that states whether or not that the state will be adopting that recommendation or proposal into the grant application or not, and why?
I will take that back and see. I mean, we may have to do it afterward. There are only 24 hours in the day, and I cannot tell you how much we have to do. I mean, anybody who's looked at the application, it is a very long and very detailed application. So we may be able to do that afterward, but I cannot promise that we could do it while we're actually writing the application. Let me say one other thing. And in terms of the why we may or may not be able to include any particular proposal, sustainability. CMS has made extraordinarily clear that these are one-time funds, and one-time funds have to be able to be sustained. They are not going to be interested in funding anything that we propose to them that cannot be sustained, from the beginning. And so as we are looking, the criteria that, some of the criteria that we are using to evaluate the proposals that came in, and there are, how much does it meet the goals? How much, is it doable? Is it fundable, et cetera? But two critical things: is it transformational? Is it, truly going to make a significant difference? Will we be able to measure the difference that this makes? And is it sustainable? if it is transformative but not sustainable, may not work. If it is sustainable but not transformative, it may not work. So those are key for as we are thinking about it. And Nicholas, I will take back your suggestion, your request, and we will see what we can do. The application, of course, will be public when it's finished.
Perfect. Thanks, Marty. Appreciate it.
Thank you.
Any other questions or comments for Marty or for James? If not, thank you very much, Marty. And we are now going to go from the big picture planning issues to a couple of programs. And we are happy to now be able to introduce Karen Holy from Kent Hospital. Karen's the Director of Education and Professional Development and a key partner in one of the Ladders to Licensure partnerships. So Karen, turn it over to you.
All right, thank you. And I apologize. I wanted to have a couple students speak to this today, but they are all, I want to say unfortunately, but it's actually fortunately for them, they're all in class today. So they are all in their lecture, their lab portion of the nursing program at CCRI. So we currently here at Kent have 8 individuals that are part of the first cohort of students that are participating in the Ladders to Licensure. It's been an amazing opportunity for these individuals, a lot of hard work, but they are very grateful for the opportunity to participate in this program. A lot of our staff that we have at Kent are very loyal, not only to Kent, but to the community and the state itself. It's a very small local community hospital, so we tend to have individuals that start with us at Kent and stay with us at Kent. So I am happy to say that a majority of the individuals that are in our program have been with the organization for a really long time. I have one individual that has been a CNA at the hospital for 20 plus years. A dream of hers has always been to be a nurse and to go through the nursing program. Had started and stopped at multiple times and just never had the support that she needed to be able to continue on with the program. That tends to be the overarching theme of the students that we selected to be part of this first cohort. They've always had the lifelong dream of wanting to be a nurse, but just never had, again, the resources and support available that this program has offered them. So it's been an amazing opportunity for the individuals that were selected to not only be in the program and participating with other peers throughout the organization, but also to look ahead into the future. And once they graduate, bringing them or keeping them, I should say, in our pool of employees, because they very much still want to continue on with their employment at Kent Hospital, just in a different role. So they'll be going from a support role as either a CNA, we have a phlebotomist in the program, we have an EKG tech, to now transitioning to the bedside where they are caring for our patient population. So again, it's been an amazing opportunity for them. I know that they were very excited to come and speak to you all about the impact that it's made on their lives and the opportunity that they now have that was presented to them that they otherwise would have been a lifelong dream that they would never have been able to accomplish. So they are very grateful for the opportunity and the support, and we are very much looking forward to our next cohort that we are in the process of vetting applications for right now. I don't know
That's
if you want to
fantastic.
speak to
Thank you
anything
so
else.
much, Karen. Yeah, Karen, I wondered if you might say a word about the pre-nursing work that the students did, supported by CCRI earlier this year.
Yeah. So the support that we've received from CCRI through this program has been amazing. I myself was a previous graduate of CCRI. I got my associate's degree in 2007, I think. It's probably dating me a little bit. But when I went through, not that I didn't get support, but I was kind of isolated and kind of made friends along my way. So the nice thing about this cohort is with the support of CCRI, they're putting them through testing and classes and trainings to help them not only with like the enrollment in these prerequisites and classes that they needed to get into the program, but they were offering them support and programs and tutoring to help them successfully be prepared for taking these hard nursing prerequisite courses that we have. So one of the classes that I can think of in particular is A&P, so anatomy and physiology, which tends to be a really hard class that students struggle with. They gave them a prep course, they worked them through, there were study sessions, tutoring. So outside of like the normal work that an individual was doing to get into the program, they also had the support that they needed to successfully complete the courses. And then on top of that, if they were struggling with needing a laptop or other resources outside of like the schoolwork, they were getting assistance from that as well.
That's great. Thank you so much. I want to mention that Brown University Health is also, several of their hospitals are partners in the partnership along with Kent Hospital that Karen just described. And I would also mention that there are 2 additional ladders to licensure partnerships. Both of those are focused on behavioral health. One is led by Rhode Island College and Tanya Glantz, who you heard from earlier, and the other is led by William James College, which is a behavioral health focused institution of higher education. And I suspect there are partners of both of those partnerships represented here in this meeting as well. Similarly, with cohorts and supports for individuals who are at various levels of their careers and various prior educational experience who are pursuing an advanced degree in many cases in behavioral health, as well as eventually a clinician license. So we really appreciate all the work of all the partners. And I lastly want to mention that we are currently receiving proposals from other potential partnerships. So for one additional Ladders to Licensure planning grant, which will go into effect in January and will enable a sort of fledgling partnership to spend 6 months developing their vision, their career ladders, their outreach, their plans for education and career ladders in a different field other than the one, or a different sector other than the ones that we're currently funding. And those proposals are due by October 31st. And the information you can find on our website. If I have a moment, I'll post it in the chat. But if you look under Ladders to Licensure on the EOHHS website, you'll see the information about the planning grant there. So thank you so much, Karen. Really appreciate you joining us. Jump forward now to our final presenter, who is Barry O'Connor from the Commerce Corporation. Barry's going to talk to us about the Wavemaker Fellowship Program, which is also supporting individuals who through their higher education and beyond. So Barry, take it away.
Thank you, Rick. Good afternoon, everyone. I'm here to talk to you about the Wavemaker program, which is a student loan repayment initiative designed to attract and retain talented professionals in key sectors such as STEM, healthcare, education, and design in the state of Rhode Island. By offering incentives, the program supports recent graduates working in the state, helping them reduce their student loan debt while contributing to the local economy and workforce. I thought that it's important to, on the next slide, to show you at a glance what student loans have done to people throughout the nation and also in the state of Rhode Island. So the current student loan debt in the nation is $1.81 trillion in this United States. In the state of Rhode Island, the average student has about $33,270,000 owed upon graduation, which is 19th highest in the nation, which was a rise from second in the nation last year. So we've made some strides here in the state of Rhode Island, and programs like the Wavemaker Fellowship Program and the like have made a great impact on our students or our graduates in this state. We actually have an open application period right now. It ends October 13th, so a week from today. And this is a great opportunity for everyone to have an opportunity to spread the word. We have a specific carve out of $500,000 for primary care providers. First time that we've had that in our cohort's history since 2016's inception of this program. Next slide. So how it works is we started this application period in August 18th of 2025. It'll close, as I said, October 13th, 2025. And the applications will be reviewed and awardees will be notified by November 10th, 2025, if they're accepted into the program. In the chat, I will post the WaveMaker website, and I'm happy to take any questions.
Thanks, Barry. I wonder if you might just say a word about how much funding is available for individuals based on their
that's
level of
great
degree
point.
and so forth.
Great point. So the average student, if they have an associate degree, can get up to $1,000 every year for up to 4 years. Someone with a bachelor's degree can get $4,000 every year for up to 4 years. And those with the master's or professional degree can get up to $6,000 for those same 4 years.
Thank you. Other questions for Barry? Strongly encourage you to spread the word. Okay, Faye, sorry.
And I'll say this because we have
Yes.
a good cross section of folks on this call. As of this morning, we have 18 healthcare individuals that have applied to the program, 6 primary care providers. So that, as you can imagine, we want those numbers to go up, obviously. So I'm hoping that you could spread the word as best you can today and throughout the week.
Yeah, there's 500,000, just to repeat what Barry said, $500,000 earmarked for to support primary folks working in primary care who have higher education debt. Faye.
Hi, Barry. I was just
Hi.
curious what the WaveMaker program is doing to consider students who've been impacted by like the multiple forbearances and everything, since a lot of healthcare workers are public service loan forgiveness participants.
Those individuals are already in the program. The WaveMaker committee has decided to extend an additional year to those individuals that have been impacted by the various situations that have arisen and place them into forbearance. If someone's applying, it's very important that they have a history of payments over a course of time. So maybe this may not be the best time for them to apply. Maybe once they go into repayment, then they apply to the program. We should be opening up the application again in January.
Thank you.
You're welcome.
Any other comments or questions? If not, I just want to thank again all of you for attending and all of our presenters for presenting. Hope you find these meetings useful. I know they're quick and a lot of information in a short time, but that's actually the point, to try to give you a lot of information and not take up too much of your time. Yes, Bob Marshall, we do have a minute or two left.
Hi, thank
Bob,
you. I was just wondering, and I was hoping I heard something, but I didn't. So I figure now's the time. We did get passed last year the legislation to allow the use of speech and language pathology assistants. Are we doing anything on trying to recruit people into that, get training available for them, so that we can start addressing that shortage of speech and language, and especially for nonverbal, which there really is a dire need for.
So I'm guessing this is not just a question about WaveMaker, but I'll just note that WaveMaker.
No. Okay. Yeah, I thought
okay.
you were going to
No, that's fine. That's fine. I am not aware of any specific programs to recruit speech and language pathology, but they would be certainly within the the universe of programs that or supports that exist for healthcare workers and healthcare professionals. So perhaps there is an opportunity for partnerships or proposals, funding proposals, either through the Real Jobs program or the Ladders to Licensure program. I'd be happy to talk to you more about that offline.
So let's do that
Absolutely.
because we, in getting the legislation passed, talked about, some, maybe moving some people up from direct care or from those kinds of situations. So let's talk about that offline. Thanks.
That'd be great. Yeah, be in touch. Thank you. Okay, last call for questions. If not, thank you all for joining, and we will look forward to seeing you in the near future. Thanks again.